Good morning. I'm Dr. Mark White, internal medicine here at Gateway Health and Wellness. And there's about 6 things that you need to know if you've been tested positive for COVID-19. The first thing is to review back over the symptoms that you've had during this period of 14 days. And if you're back to baseline and you're feeling pretty good and you're ready, you feel like you're ready, no fever, no cough, no shortness of breath, no stomach symptoms, no muscle aching pain. All of those symptoms are gone. Your appetite is back. You can smell again. The second thing that you want to do is to go to your doctor and ask to be tested, because we want to make sure that you're negative at this point. Your symptoms are gone. We want to make sure that you're negative. Your employer will want to know that you are negative and make sure that you are not contagious to the rest of the employees or workers or what have you. Also, at that point, it's very important because after you have been diagnosed with COVID-19, there's a small period of time that you may still be shedding the virus. Even though the numbers or the concentration of the virus that you might be shedding is very low, it's very important at that point that you wear a mask and that you wear gloves, that you're washing your hands, that you're really aggressively doing all the PPE recommendations that you've been given, so that if you do still have a little bit of virus, even though you've tested negative, you want to make sure that you're not going to be contagious to others. Start to review your emotional status. We want to make sure that you've been out of the office or your work or from your family for 2 weeks, and now you're feeling emotionally, you may be feeling a little off balance. Start to journal. You may want to meditate. Whatever you do that can get you back in balance with your family, with your job, with your children, etc. That's really, really important. And remember, the most important thing that you can do as you re-enter after you've been positive is definitely wear your mask, definitely wash your hands, definitely do all of the things that have been recommended, because you still may be shedding a little bit of the virus. And even though some of the studies show that you're not contagious, that your immunity is up, you still want to make sure that you're doing all of the things that have been recommended to do. Thank you.